Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Welcome to the Pattaya City Expats Club. G'day and Swaddy Cup, as I like to say. Today we were treated to two wonderful talks on a really big worldwide problem, which is diabetes. And this was just, you did such a wonderful explanation of the technical aspects of diabetes. So how widespread is diabetes, say, in a country such as Thailand? What proportion of people over the age of, say, 60 have diabetes?
Now, from the incidence of diabetes in Thai people is around 30 to 40%, as seems to be increasing every year.
Yes, and there's a very high proportion of deaths from diabetes in Thailand, yes?
Yes, but the cause of the death is from the severe complications, but that originate from the diabetes.
So what, in terms of people who are watching this, they're either diabetic, pre-diabetic, or worried to get diabetes. So what's some of your tips for, how to discover you might be getting close to getting diabetes? Like diabetes is now a real danger. What are the symptoms that diabetes might be happening to your body?
Okay. So many symptoms can happen. Like, the classic symptom is like you feel thirsty a lot and you want to drink any sweet drinks all the time. Your weight lost unintentionally, and you feel like dizzy. You feel like thirsty and hungry so much. So these, if these symptoms happen, maybe you should see the doctor. You should check your blood at the hospital.
Yes, and one of the other things is this really I was interested in is that the Ozempic can actually help with the treatment of diabetes and prevention of it as well, perhaps?
Okay. Normally the Ozempic is groups of the medicine called GLP-1 agonists that at the first time that they launch into the world, the indication is to use to control the blood sugar in diabetic people. But because of in the study they found that they also have the benefits like can cause weight reduction. So that's why now the other indication to use is to help the weight reduction in diabetic people or even in normal people.
So if you can use the Ozempic, say you've got diabetes, and of course a lot of people with diabetes have got that because they're fat and overweight. It's one of the reasons. So this could actually mean that they have less of other medications like metformin. Perhaps if they take the Ozempic and lose weight, they need less medication.
Oh yes, because in the past, because at that moment there was no Ozempic yet, right? But nowadays, because of the GLP-1 agonists and because of their benefits, so now the first line drug to use in the people who have diabetes or pre-diabetes or in obese people is Ozempic or any GLP-1 agonist, not the metformin.
Well, that is really interesting. I really did not know that. What about the psychological effects of Ozempic? Because I know somebody's on Ozempic and they seem to have some mood issues and depression and anger issues. Is that unusual? Not really like angriness increasing or something like that, but it because there are GLP-1 receptor in the brain also, so that it's act in the brain like a suppress your appetite. Yeah, but someone with their happiness is because of eating. Yeah, so they can feel like calm down and they can feel maybe not like feeling so fresh or feeling of the spike of the sugar in the blood like that. So that's they can get more emotion. So that's interesting, right? You take the Ozempic, and because you're not getting the satisfaction and life satisfaction of eating and getting taste all the time, this can then affect your mood. That's very interesting. Well, thank you so much for a truly wonderful talk. You really want to watch the talk. It's so informative. And thank you for finding the time. Now she has to rush off and save someone's life, okay? She's a doctor. So thank you again, Dr. Karnsiree.
Thank you so much.